I think the second he got out of the scanner, I got a text, and he said, "How's my scan look?" I said, "Can you give me a few minutes?" But actually, we were all very hopeful that his scan would look good, and I reviewed it with our radiology team, and we all concurred that it was completely normal, which was, our goal. Typically, with Hodgkin's disease, if the scan is normal with the completion of therapy, patients do well. We're obviously going to watch them closely. There's a small chance that it could recur, but for now, we want him to just move on with his personal and career goals and just come in for his routine checkups. But there will be no restrictions. His port will come out in the next few days. The port has precluded him from having any contact. But once the port's out and that area heals, then he's free to do whatever he wants, and certainly engage in contact once practice starts back up.
Doctor, how would you describe James as a patient?
Fabulous, really remarkable. For someone that young, his age, he had incredible fight spirit, handled things remarkably well, never complained. He, considering who he is, he was very humble. It was kind of interesting because when he was about to start chemotherapy, I offered him the option of having some privacy, or being in an area of the Lemieux that would keep him from having much contact with the other patients. And he said, no, I want to be with the other patients. And throughout his treatments, he would actually walk around and talk to other patients and give them hope and inspiration, and just really remarkable.
What's the window for monitoring or potential recurrence? Is there a timeline on that? Do you watch?
Yes, it's a good question. So typically with Hodgkin's disease, if there's going to be a recurrence, most of the time it occurs within the first 2 years. Now, we're still very optimistic that he's cured, but there's a small chance that it could come back. Certainly the negative scan is a very positive sign. But we will be monitoring him between examinations, lab work, and then periodic scans. But the window is really this 2-year period. And then after 2 years, it's very unusual to have a recurrence. So that'll be, the period where we monitor him the closest. But other than coming in for his exams and testing, he's, got no restrictions.
Has the medical community come up with any kind of possibility of a cause for this? What could lead to it?
That's a good question. There are lots of theories. We actually think that some cases of Hodgkin's disease are caused by the Epstein-Barr virus. We think that other cases may be caused by other viruses. But in reality, most of the time, we just don't know what causes Hodgkin's disease. It is a disease that's very common in younger folks, much more common than in older. There's actually a bimodal distribution, but most of the cases are in young, healthy people like James.
Doctor, how many years have you been in practice, and what's your official medical title? Are you like an oncologist, or what do you call yourself?
Are you trying to get my age? Yeah, I'm what's called a hematologist oncologist, and I've been in practice for 38 years.
And when you got into the medical profession, is one of the rewards making the phone calls like you made to James?
Yeah, absolutely. When I think back to when I was in training, the cure rate in this situation was a lot less. And certainly the drugs were a lot more toxic. We didn't have, for example, the nausea medications that we have today. We didn't have the support drugs that we have today. It's interesting, we know this is one of the curable cancers, but we're now focused on minimizing side effects, both short-term and long-term. And so historically, radiation was a big part of treatment for Hodgkin's disease, and now we try to avoid that, particularly in younger patients. There's long-term risks of malignancies and cardiac damage. And so in this situation, historically, he might have gotten radiation therapy, but nowadays, with a normal scan, we recommend just following him.
Doctor, can you give us an idea of what he went through, what treatments were like, and what it...
Sure. Well, he was getting chemotherapy every 2 weeks. The sessions lasted around 3 to 4 hours through his port in his chest. The drugs are administered. What we do is we give very strong nausea medicine first, and then, after we give some time for that to kick in, then the drugs are dripped in. He really tolerated it quite well. The most serious side effect of these drugs is on the bone marrow and the blood counts. And for the most part, his blood counts held up very well. There were a couple of periods where his white count dipped a little bit, and just for precautionary reasons, we had him stay on some antibiotics. But overall, he really tolerated it well. I mean, one of the more common side effects, particularly toward the end of therapy, is fatigue. And it was really remarkable that he was able to continue to function, go to practice, run on a treadmill, and remain as active as he did, particularly in the last couple of months of treatment. Most folks are pretty wiped out by then.
Doc, did you ever imagine that a call from you would be compared to a call from an NFL general manager on draft day?
Not quite. I mean, I haven't had that analogy ever, but it was certainly great to see that scan. I mean, when we look back at the original scan and how impressive his cancer was in terms of size, and to see it 100% gone was really. We were all very excited. It was kind of interesting because everyone was holding their breath waiting to see the scan report, and the nurses and the valet out front and the greeters at the Hillman and the people that bring him lunch. Everyone was, how's James' scan? How's James' scan? I mean, just everyone loves this guy. He really is a special young man.
Dr. Mark, I mean, would you classify this from when he got diagnosed to where we are now to, I mean, it sounds like it went about as smoothly as you could have hoped from when the diagnosis came down?
Yes, so it's really important with this disease that the treatments stay on schedule and that you give full dose every 2 weeks, because if you have to miss a dose or if you have to reduce the dose, it really does impact the cure rate and the outcome. And so fortunately, he never skipped a beat. He got his full dose every 2 weeks and really didn't have, a lot of side effects.
Doctor, you touched on it, but how much did other patients watch how he handled his chemotherapy?
Well, the patients that were there on his days of treatment were obviously aware, and it was interesting because he was there really trying to inspire other patients. It was really remarkable to watch, and the other patients were rallying around him and rooting for him, and it was really beautiful to just see what he had created there at the Lemieux. The days that he came in, there was just a lot more excitement and chatter, and as I say, he really served as an inspiration to a lot of patients, those that were doing well and those that weren't. But everyone was just excited to see him and talk to him. And football aside, I mean, he's just really a special young man. He really is.
Doctor, perhaps before we wrap up, you can talk about why we're here at the Duquesne Club today and the event that went on this morning.
Sure, happy to. So the Leukemia and Lymphoma Society of Western Pennsylvania has an event every year in October called Light the Night at Heinz Field. And it's a walk to raise money. It's actually a national fundraiser, but we have a very successful local event. And We will raise close to $1 million this year with Light Tonight. It's one of the largest events for the Leukemia Society. So what happened was, literally 6 months ago, they called me and said, can you have James Conner come and speak at our Light Tonight breakfast, kickoff breakfast? And I said, there's no way I can predict, A, how he's going to be doing, how he's going to be feeling, or if he's going to be in a remission. I said, so let's just put it on hold and assume he's not going to be there because the timeline's too tight. So of course it just worked out beautifully where he had a scan yesterday, scan was clean, and I said, all right, now that I gave you good news, I need a favor. I said, tomorrow morning at 7:30, I need you at the Duquesne Club. Can you be there? And he said, anything for you, Doc. So it really was great, and he came, and certainly the crowd that was here we had our largest turnout, close to 200 people, which are largely corporations and businesses in town that have walk teams to support the event. And he was just an added attraction, and he had some very short but certainly emotional and inspirational comments for the audience. It was great to have him here.
I guess just from a technical standpoint with James, I mean, is he in remission now, or
Yes.
is he completely cured?
He's in remission. We won't use the term cured yet, but he's in what's called a complete remission. There's no sign of any cancer.